Today's presentation is going to be about the safety guidelines for Freon, what are the hazards and how to protect people from it. The chemical name for Freon. Freon is a registered trademark of DuPont and refers to chlorinated and fluorinated hydrocarbon solvents. Freon 11, also known as trichloromonofluoromethane. Freon 12, dichlorodifluoromethane, and Freon 113, 1,1, 2-trichloro-1, 2,2-trifluoroethane. Chemical description of Freon. Freon is a clear, colorless liquid or gas. Freon 11 is nearly odorless, slight ethereal odor at high concentrations. Freon 12, ether-like odor. Freon 113, similar to the odor of carbon tetrachloride. The vapor density. Freon 11 has a vapor density between 4.7 and 5.04. Freon 12 has a vapor density between 4.1 through 4.28. And Freon 113 has a vapor density between 2.9 through 6.5. Freon vapor is heavier than air and may accumulate in low-lying areas along the ground, displacing oxygen and posing an asphyxiation hazard. Industrial uses for Freon. Freon are used as refrigerants, fire extinguishing agents, local anesthetics, aerosol propellants, blowing agents for foam, chemical/synthetic intermediates, and heat transfer mediums. They are also used as solvents for oils and gums, for degreasing, and for dry cleaning. Chemical hazards. Reactivity. Freons are stable under normal conditions. However, there are some flammability issues. Freons are generally non-flammable and non-combustible, but Freon 113 will ignite and burn weakly at 1,250. General health hazards. Freons generally have a low order of toxicity. However, exposure to relatively high concentrations, usually above 100 parts per million, may produce adverse effects on health. Possible exposure routes can include inhalation, ingestion, skin, and eye contact. Freon vapor may cause irritation of the eyes, nose, throat, and mucous membrane at low concentrations. At high concentrations, Freon vapor may cause pulmonary edema and neurological problems such as central nervous system depression, dizziness, headache, drowsiness, tremors, seizures, confusion and coordination, loss of consciousness, and paralysis. At extremely high concentrations, several thousand parts per million, Freon vapor has the potential to reduce the amount of oxygen available for breathing, especially in confined spaces, which can lead to suffocation. Acute health effects. Acute exposure to Freon vapor can result in eye, nose, and throat irritation, palpitations, lightheadedness, dizziness, disorientation, headaches, and tachycardia. Impaired coordination, reduced mental acuity, unconsciousness, or death can occur at very high concentrations. Chronic health effects. Chronic use of Freon 11 has been linked to disease of the mucous membranes, lungs, and central nervous system. In the occupational setting, chronic fluorocarbon exposure has been associated with a syndrome of impaired psychomotor speed, impaired memory and learning, and emotional instability. Repeated or prolonged skin contact may cause dermatitis. First aid. Eyes. If eye tissue is frozen, obtain medical attention immediately. If eye tissue is not frozen, Immediately flush eyes with large amounts of water for at least 15 minutes. Occasionally lifting the lower and upper eyelids and visit a doctor immediately after exposure. Skin. If frostbite has occurred, do not rub the affected area. Flush with water or remove frozen clothing from frostbitten area. Seek medical attention immediately. Otherwise, immediately remove contaminated clothing and wash contaminated area with soap and water for at least 15 minutes. Ingestion. If freons are ingested, do not induce vomiting, as the hazard of aspirating the material into the lungs is greater than allowing it to progress through the intestinal tract. Drink 1 to 2 glasses of warm water and obtain medical attention if necessary. Inhalation. Move exposed individual to fresh air immediately. If person is not breathing, give artificial respiration. If person has difficult breathing, give oxygen and seek medical attention. Standards for Freon 11, 12, and 113. The ceiling limit is 1,000 parts per million. The stale not established. Time weighted average for 8 hours is 1,000 parts per minute. Immediately dangerous to life and health, 2,000 parts per minute. For Freon 12, ceiling limit not established. The stale is not established. The time weighted average for 8 hours is 1,000 parts per million. Immediately dangerous to life and health, 15,000 parts per million. For Freon 113, ceiling limit not established. The stale is 1,250 parts per million. Time weighted average for 8 hours is 1,000 parts per million. Immediately dangerous to life and health, 2,000 parts per million. Personal protective equipment and how to protect yourself from Freon. Wear lined, cold insulating butyl gloves when handling liquid Freon. Wear chemical splash goggles and a full face shield if splashing of liquid is likely to occur. Contaminated clothing should be removed promptly and replaced. Wear personal protective clothing to prevent skin contact. In an emergency or entry into areas of unknown concentration, wear a self-contained breathing apparatus that has a full face piece and is operated in a pressure demand or other positive pressure mode. Do not wear contact lenses when working with